Hey everyone, today's important topic is pernicious anemia. We are going to discuss the key facts of pernicious anemia. What is pernicious anemia? Pernicious anemia, how it is caused, what are the clinical features, what are the diagnostic modalities, and what may be the possible ways of treatment. So, pernicious anemia, it is an autoimmune disorder. It's clearly an autoimmune disorder where you see autoantibodies against parietal cells and you see antibodies against intrinsic factor. There is a destruction of parietal cells and intrinsic factor. Also, there are antibodies, two type of antibodies against intrinsic factor, that is blocking and binding antibodies, which basically blocks the attachment of intrinsic factor to B12 and also intrinsic factor B12 complex to the receptors of intrinsic factor on the terminal portion of ileum. So these abnormal antibodies are seen. And what are the consequences of autoimmune disorders? The consequences are there is a destruction of the gastric glands. There is a achlorohydria that is clearly being seen. There is atrophy of gastric mucosa that will be seen. A chronic atrophic gastritis, and as you all know, it predisposes to gastric adenocarcinoma. So that is there. There is absence of intrinsic factors, so vitamin B12 will not be absorbed. So these are the important facts of pernicious anemia. And the achlorohydria, apart from the causing atrophic gastritis adenocarcinoma, there is a maldigestion also of the food because hydrochloric acid is not released, and there is a hypergastrinemia may also be seen in many of the patients, and even there may be gastric carcinoids that may also emerge in patients of pernicious anemia. So lab findings, what are you going to see? You are going to see all the traditional pictures of macrocytic anemia with MCV ranging more than 100 femtoliter. Hemoglobin will be in the lower range. There is a pancytopenia because B12 will affect all the cell lineages ultimately. And so the RBCs will be, you can say, macrocytic to normochromic to bit of hyperchromic. And there will be ovalocytosis may be seen. Hypersegmented neutrophil will be noted. And there will be decrease in the platelet count, which is more severe in severe cases of B12 deficiency. And as you can see in the image, there is a macroovalocytes. Ovalocytosis is being noted, and hypersegmented neutrophil is a clear-cut feature of the earliest marker of this macrocytic anemia. So bone marrow will show classical megaloblast because of the deficiency of B12. There will be giant metamyelocyte that may be seen. Hyperlobated megakaryocyte is an important feature. Reduced myeloid erythroid ratio will be seen because there is a erythroid hyperplasia due to vitamin B12 deficiency. There is a peripheral anemia because of which there is erythroid hyperplasia. So as you can see over here, there are megaloblasts are there with sieve-like chromatin pattern, open chromatin pattern, enlarged size of blasts are being noted over here. You can see in the right side top image, you can see the increased cellularity as well, and you can see the giant metamyelocytes are being noted over here. So these are the key important features of pernicious anemia and the megaloblastic anemia, which are common to both of them. So pernicious anemia is nothing but it's a kind of a megaloblastic anemia due to autoimmune destruction of parietal cells and intrinsic factor. Other lab tests that may help in distinguishing in diagnosing are low level of serum B12 will be noted. Increased methylmalonic acid will be seen in the urine because of B12 deficiency. The preceders that will be increased, the intermediate metabolite methylmalonic acid will be raised, and there will be increased serum homocysteine that will be seen. Hypergastrinemia is more specific for pernicious anemia that will distinguish it from other causes of other causes of B12 anemia. Scaling test will identify the cause of vitamin B12, and here you will give the patient radioactive B12, and you will see the absorption, how the absorption of B12 happens, and how much of the B12 is excreted in the urine. It is an obsolete test, but it may identify the cause of the B12 deficiency, including the pernicious anemia. So these are the important tests. The clinical features will include the degeneration, subacute combined degeneration of the spinal cord due to B12 deficiency, due to various abnormal metabolite accumulation. There is a degeneration of the peripheral nerve and spinal cord, and there will be deranged vibratory sensation, proprioception. So these will be deranged. And apart from that, you may see and glossitis. That is an important feature. There is a glossitis, there's a macroglossia. These features may be seen in B12 deficiency, which is common, which is even seen in pernicious anemia as well. So these are the key features. So let's have a quick recap of all those learnings which we had in pernicious anemia. Pernicious anemia is due to autoimmune mediated destruction of intrinsic factor and parietal cells. Blocking and binding antibodies against intrinsic factor are seen. And here you see low serum B12 level, and there is a macrocytosis, hypersegmented neutrophils. Bone marrow will show erythroid hyperplasia with giant metamyelocytes, and megaloblast will be seen over here. There is a hypergastrinemia, and skilling test may help in identifying the cause. And pernicious anemia, here you will have high incidence of atrophic gastritis and gastric adenocarcinoma, and also gastric carcinoid. So treatment, you may give some kind of a synthetic analog of intrinsic factor may be given to provide relief to the patient. Thank you.